The NHS is large and complex, helping hundreds of thousands of people every day. So it's perhaps not surprising that not all care is the same everywhere. NHS RightCare is helping the NHS seek out, adopt and share the best way to do things. We've been looking into what good care looks like in a number of different areas. One such area is wound care. Every year, around 2.2 million adults in the UK will have a wound that needs treatment, costing the NHS around £5.3 billion each year. So we want to tell you a story, a not unfamiliar scenario. It's about Betty, a widow who lives by herself in a village 10 miles from town. Betty has a good social life, enjoying her walking club despite a bad knee and a weekly aquafit class followed by a meal out with friends. At her 70-year health check, Betty was overweight, but the nurse put it down to her age, so there was no mention of changing Betty's lifestyle or health advice. 4 years later, one day while out walking, Betty grazed her ankle. She put a plaster on it and then spoke to her local pharmacist, who suggested a dressing to try. 6 weeks of self-treatment weren't helping, so Betty's GP prescribed antibiotics, not realising that they wouldn't help Betty's wound. 2 weeks later, Betty's practice nurse dressed the wound. For the next 6 weeks, Betty struggled to the surgery every week to get the dressing changed, but there was no improvement. Over the next 6 months, the general practice nurse tried lots of different dressings, but the wound got worse. The dermatology clinic confirmed it was an ulcer, but the test results didn't get to Betty's GP practice. Although the nurse was doing her best, her training was out of date, so she didn't feel confident applying the type of dressing needed. The appointment slots were too short and treatment was delayed as equipment wasn't working. Meanwhile, Betty couldn't bathe with the dressings, so didn't feel clean. She worried about the wound smelling, so didn't want friends to call round. She couldn't go out with her walking club, nor go to aquafit. Because of her wound, she couldn't have the knee operation that would have helped her get more mobile and lose weight. So Betty felt isolated and depressed. She was in pain and housebound with a variety of district nurses visiting, all trying to help but making slow progress due to lots of different reasons. To cut a long story short, it took 2 years for the wound to heal. From a simple graze to her leg, there were countless dressings, many people involved, a stay in hospital to deal with a nasty case of cellulitis. Only then did Betty's wound finally get the correct treatment and the pain subside. But how could things have been different? Let's rewind the clock and take a look. We are back at Betty's 70-year health check, where she was heavier than she should have been. The healthcare assistant made a care and support plan for Betty to keep her healthy. Betty lost some weight but was worried about her tired and heavy legs. The general practice nurse assessed Betty and prescribed compression stockings to reduce the risk of leg ulcers and arranged regular reviews. 4 years later, one day while out walking, Betty grazed her ankle. She put a plaster on it so it wouldn't stick to the compression stockings she wore every day. She then asked the advice of her local pharmacist, who knew just what to do. The local NHS had agreed a protocol for anyone who had a lower leg wound, so she advised Betty to see the practice nurse at her GP surgery without delay. The practice nurse dressed Betty's wound, prescribed some cream to moisturise Betty's skin and some medicine for the pain. She referred Betty to the leg ulcer clinic for a full assessment, and a couple of days later, the clinic confirmed it was a venous leg ulcer. Treatment of the wound started straight away with specialist compression bandaging that had been proven to work. The nurse also gave her an information leaflet all about it. The nurse prescribed a wound cover so Betty could have a shower and encouraged her to keep as active as possible. This made such a difference. Betty returned to the clinic the next day and again a week later to have the ulcer checked and measured. Betty was pleased to see it getting smaller. Progress. After 2 weeks in bandages, the nurse gave Betty a prescription for compression stockings to wear then and in the future and advised Betty to keep her leg moisturised. 8 weeks from visiting the practice nurse, the ulcer had completely healed. 6 months later, Betty was able to have her knee operation that meant she could rejoin her rambling club and get back to her old self. Let's recap on how things were different. For Betty, early, best practice treatment stopped the ulcer in its tracks, and within a month the wound had healed. Betty's active social life that kept her healthy and in good spirits continued, and her knee operation would go ahead without delay. And for the NHS? Providing care in this way cost around 10 times less than the first scenario. It's a win-win for everyone. Let's make it happen everywhere. Through NHS RightCare, we aim to improve healthcare for everyone, so that we all get the right care in the right place at the right time.